Hello, everyone. Thank you for joining us today. This is Dylan Kemna. I'm the Vice President of Sales and Marketing here at OptiCall. Today's webinar is part 4 of our series on how to convert more calls to patients. Part 4 is around capturing the patient. We're going to actually show you our new software and show you how OptiCall handles these phone calls when they come in. Without further ado, I'll introduce the president of OptiCall, Bill Mercier, our speaker today. Bill, are you with us?
Yep, I'm here. Thank you, Dylan, for the introduction. And thank you, everybody, for getting on the phone call with us again today for the 4th part of our series. We really appreciate you giving us some time in your afternoon, and appreciate you giving us the ability to show you some of the things that we've learned over the years, and hopefully some of these things can help your practices do a better job on the phones and capture patients and do everything that we can to give the best experience that we can for people who are looking at our services. So I'm not sure, Dylan and I have gone over the list of who's on the webinar. I know we've got some repeat people that have been back and some new people. So just for a quick slide here, I wanted to give a little bit of information about OptiCall. We are a leading provider in elective medical phone services, so we make and take a lot of phone calls for elective practices across the United States. We focus on maximizing the customer experience to convert more of those phone calls into patients. To date, we've handled well over 2 million phone calls and have boosted our clients' revenue by 15 to 20%. In fact, today happens to be our 14-year anniversary of starting the company. So we would have balloons and cake for everybody, but obviously you can't eat it. And so the webinar overview today, we want to go over the phone plan process and how important a phone plan is for your practices. It's something that we put in place in OptiCall a long time ago when we realized that we had a lot of people on the phones. We had people that were more efficient at booking and had better conversion rates. So we needed to put a phone plan in place so that we knew that everybody would be consistent on how they answer the calls when they come in and what they're doing throughout the process of handling that call, from hello to goodbye, thank you for calling. So we want to review that phone process. We're going to preview what we do on our phone call. So as Dylan had mentioned, we're just launching a new phone scripting software for our team. So I'll show you how it works. And it really kind of ties in all of the pieces of the phone process that we've talked about in the previous webinars that we've done. And the biggest one is don't drop the ball and follow up. And that's one of the most important pieces for capturing the lead and why we capture leads in the first place, because we know that we're not going to treat everybody with a procedure or treatment when they call in and they come into our offices. We know not everybody converts, but if we don't capture the leads and capture enough information to have some sort of way to follow up with them, if they do not convert, then we're missing a huge, huge opportunity for a lot of additional revenue for our practices. So what have we learned so far in the whole webinar series? Here's some of the key points that we tried to go over. The nature of the patient that's calling in or emailing in has changed. And what I mean by that is things have changed with technology. There's been a major impact because of the whole concept of consumerism on expectations with companies like Uber and Starbucks and all these companies that are trying to create experiences out there. Well, that has impacted the medical community because they have a set of expectations for everything else that they're experiencing throughout the day. And when they contact our practices, they want to follow through with that same feeling. So the way that patients are looking at our service when they make that phone call is so completely different, and the processes that they go through before they even pick up the phone. Second thing is consistency is the key for expecting great performance from your team. Making sure that everybody's on the same page with not only your customer service mindset and how you want these callers treated when they call in and when they come into the office. Everything has to be consistent with everybody in your organization. And developing a phone plan is the key to consistency when that person's calling in and giving out the same experience regardless of who's calling into your practice or who picks up on the other line. And the third piece of this is customer engagement is the key to building rapport. And the one thing about customer engagement is that it creates relationships, and relationships create loyalty. And I know many people that are on the phone today work in practices where that repeat customer is very, very important. And so keeping in mind that what we want to do is we want to give these patients the feeling that they are getting an experience, that their call is not a transaction just to book them. The more we can do that and follow that concept all the way through the visit, the more we're going to create that loyalty, and the person's not even going to think about calling another practice for that same type of service. They're going to continue to come to you. And it's so important to do that. So let's get into, I want to show you a little bit about how OptiCall does it. I need to pause this screen here, and I'm going to bring up the program that we have, that we use. And whoop, that's not it. Let me just, here it is. Okay, good deal. So we call this program OptiTRAK. This is for internal purposes, and we use it for all of our practices.
Bill, you might want to hit, oh, there we go. I can see it now. I couldn't see the software.
All right, Sounds good. So basically what happens when a phone call hits us is it creates a new call. Now I'm going to do it manually because I don't have a phone call hitting my phone system right now to give me a new call. So I'm going to hit this manually, and I'm going to get rid of this administrative stuff on the side. So essentially, as we've gone through our webinars, one of the things that we talked about when creating a phone plan is that a phone plan actually has a process that it goes through. It has an introductory phase. It has an exploration phase, which is learning more about that caller on the phone. It has an education phase, which is letting them know what the next step is, answering questions, different things like that. And it has a closing phase, which is really geared on getting the rest of their information so that you can do either they're booking an appointment or so that you can follow up. And you don't have to have this in electronic form. This can be a piece of paper that your staff follow and go through these steps right on the side as they're taking that phone call and mark this down. But it should get into, whether it be an Excel spreadsheet, or it should get into some tracking mechanism so that you know what's happening with these patients as they go along. Now, on our program for our team, we've got, and I opened up a LASIK call just because I can't, there's so many different specialties on the phone with us today that I can't open up one for every single specialty. But the scripting follows very much the same. We've got our frequently asked questions over here, and as you recall, if you've been on the previous webinars, one of the key points was make sure your team has the answers to the most frequently asked questions. How much does it cost? Is insurance going to pay for it? Different things like that. So we've anchored them on the side so our team can answer a question just by clicking a button and the script pops up for them. So let me kind of follow through the process of that logical progression of the phone call. And one thing that we do have is we have a live feed into the weather where that practice happens to be. We have a little button here that allows us to set the scripting that this is a LASIK phone call, and we're going to continue with this phone call and ask questions, answer questions, and see what we can do to help them. We do want to know if somebody's ever called us in the past so that we don't have to repeat all the information. So I'm just going to simply click no here. And the next thing that we're going to do is we want to get their first name. So now we're on to that introduction phase that we've talked about in the logical progression on previous webinars. So if we put in here, do you mind if I get your first name? So before we even get to this, and we're answering the phone, thank you for calling Jones Laser Center. This is Bill speaking. How may I help you? Dylan's calling up and he has questions. One of the things that I would like to do is make him feel welcome. So whatever his question is, they say, great, I can definitely help you with that. Now, do you mind if I get your first name? So we put Dylan in here. I don't want to go into demographic collection mode here. You can see that I do have a field for last name, but I don't want to collect his last name at this point because at that point, if I'm trying to collect everything about him, I'm on my agenda and not on his. I'm not answering his questions. I'm asking him questions that are really fulfilling my agenda and becoming more transactional than an experience. So really on this intro tab, we want to know the first name and, hey, is there a good number I can reach you at just in case we get disconnected? I can give you a call right back. And so I put in Dylan's number in here. Now this isn't Dylan's number, but I'm just putting it in. And one of the other things that we want to know is, how did you hear about us today? So very simply, in the introductory phase, we've done it electronically. You can do this on a piece of paper. We're finding out first name, telephone number, how did you hear about us today? And now we have a lead that is captured. So even if Dylan got off the phone right now, let's say he asked, hey, can you tell me how much it costs? And we go over and we answer the price question for him, and he goes, oh, you know, that's really way out of my budget. I'm really going to have to wait a couple of years before I have this done, and whatever he says. Even if we exited this call right now, we still have Dylan captured in a system, so we can count for this phone call and that it was a lead and that it came in off of the radio station 101.3. So the next tab that we have beyond introduction is exploration. Now, exploration is learning about the caller, finding out about what their needs are, what issues are they having, what is it that they're interested in, why are they interested in that. Now, if we're looking at vision problems, it could be somebody is having a problem with their distance or reading or whatever it may be. And this is just simple decision trees. Now, for your practice, again, you can do the same thing on a piece of paper. So are you wearing glasses or contacts to correct that right now? And we're learning more about this caller, but we're also building a record around them. So at any point, if Dylan leaves this phone call and never converts into an appointment, we still know all about Dylan and everything that he's given us for information. So I'm going to put in, he's got soft daily contact lenses in. Dylan, did you have a question?
No, I was just agreeing with you.
Okay, good. So the next tab, now this, you can have a whole series of questions in here. It's really up to you on what you want to ask them. Do you know anybody who's had the procedure before? Oh, who would that be? So what we're trying to do is trying to build rapport. We're trying to learn about the caller. We're trying to let them know that we have an interest in them. I can tell you I listened to a few real patient phone calls for a practice this morning that we're doing some coaching with, and every single phone call that I listened to was completely transactional. There wasn't one element of friendly customer service on any of the phone calls. It was all about what type of insurance do you have and what day do you want to come in and just book them. So there's no experience there. And the whole idea behind this is to create some experience.
And just to clarify, Bill, was that for a mystery shop review, or
it was actually there's a brand new practice that we are going to start to do some coaching for. So we haven't done anything yet. We're just getting a baseline of what they sound like right now.
Okay.
So that would
to clarify that they weren't OptiCall calls that you referenced.
No, they weren't. It's more for our ACE training program. So so let me move on to the next phase, which is education. Now, again, on the side here, I've got all the frequently asked questions. So any question that comes up, current promotions, anything that your team would need to know, you need to have that easily accessible for them. But for us, the education is really about, we know about the caller, we know that they're in glasses or contacts or whatever it may be if it's a vision call, and the first step is what we're going to be telling them about and educating them on. So in this case, it's a brief screening is the preferred method to bring somebody in. We want to let them know whether there's a cost involved with it, how long they'll be at the office, and who they're going to meet with. So we're setting expectations as to what that visit is all about. So now let's say we go through this whole process, and Dylan says, we make a call to action. Would you like me to take a look at my schedule? Or I have some appointments coming up next Wednesday. If you'd like, I can get you in there. He says, well, I'm not really ready to do that. Two things that you should do. You want to make sure that you're indicating that somebody is not ready to book, because you do have a lead here that can be followed up on at some point in time. But one of the things that we can do that's a little bit different, first off, we indicate what is it they're interested in if we're going to send some information out. And we don't want to ask the caller this, but we want to indicate, why do we feel they didn't book today? Was it a scheduling thing? Was it too expensive? What could it possibly be? Because as we look Dylan up at some point in the future, we'll know that maybe finances was the issue, and one of the financing companies just came out with a brand new program that has a super great deal. Let's get in touch with Dylan and do some follow-up and see if we can get them back into the office. But if you're not capturing details at this level, you'll never know what to follow up with them about and what their hot buttons are. So the next tab is really, I'm just going to put Dylan Kemna in here. Did you have a question, Dylan?
I just wanted to mention real quick just that on the mystery shops that we do, that capturing the patient is missed on so many, over 90% of the evaluations that we do, where if somebody's not ready to schedule, most of the practices that we evaluate let them off the phone without any other call to action. So if there's one thing that you could really take away from today's presentation, it's make sure that you have some kind of offer for those that aren't ready to schedule. And we thought it'd be more helpful to show you what this looks like than to show you what it looks like when we schedule a patient. It's a similar process, but just to make sure that you're maximizing these opportunities.
Exactly. So if we would have made Dylan an offer to receive an information pack, we would put the rest of his details in here and complete this phone call as a phone inquiry, send information. Now, we've talked about in previous webinars, there are different buckets to put people in. If I click on this call type again, I can see I've got phone inquiry still researching as well, or phone inquiry needs additional information. And these mean different things to us, but it's important to categorize them in your practice too. Somebody who wants to receive an information packet because you made that recommendation because they don't want to book right now, you're going to be able to capture the rest of their demographic information. They're going to give you everything: address, phone numbers, date of birth. They'll give it all to you. Some people will tell you on the phone, no, I'm just, I'm poking around on the website. I don't need any information. That's fine, but, thank you for your help. Those people would fall into the category of phone inquiry still researching. It's important to categorize these properly because it will tell you a lot about your marketing. And it'll also tell you a lot about the people who are calling in. Some people don't need additional information sent to them. I'm one of those type of people. If I'm looking at something on the internet, I'm not ready to buy it right now, I don't need you to send me an information packet. I've got your website. I can take a look around. I've asked you some questions. I've got some answers. But the reason why you still want to categorize these people is because most practices do not. They only count the people who want the information. They don't count the people who exit the phone call and don't give them any information. And so that's why we have included this. Even if Dylan just gave us his first name and left the phone call, we would put it as phone inquiry still researching. So let me click on this and end this phone call here. And so what this tells us now, I'm going to do a quick refresh so we have our full screen. What this tells us now here is Dylan Kemna called. He's phone inquiry send information. I can click on this. And for follow-up purposes, I can see everything. And this, again, is something that you want to put in if you're doing it manually or you have a system that you're using currently, whatever it may be. You want to be able to look at these things. You want to be able to know how he called in, what were the issues that he was having. You want to know all the details about this person, any demographics, notes that can be put in here. You can see I was testing this before. I put this person in here, and I've got some notes in here. Anything that will help you do some sort of future follow-up because they didn't convert at that moment is what you want to key in on and keep track of those things. And why do we want to do that? Well, let me bring up my presentation back up here. Why do we want to do that? Well, we don't want to fumble the ball on the 1 yard line. There's so much missed opportunity with patients that are calling in because we have to understand that not everybody is going to convert right now. So getting a no can mean really, literally hundreds of thousands of dollars for your practice. So let's take a look at this. If we do just this simple scenario, let's say a practice does 2 consult days a week. They do 5 consults a day, which means 10 consults a week or 40 consults a month. And only half of those convert to an appointment or a procedure. Now, a lot of practices are much better than that, but let's say only half, so 20 convert. That means there are still 20 people that are thinking about having the procedure done. Now, what does this mean for our practices? First off, we need to create a strategic plan to convert those, even just 20% of those no's to a yes. So if we got 20 patients that said no, and the average procedure cost is $4,000, 20% of 20 is 4. So actually, it's 20% of 20 is 5, right? So I miscalculated that. So it's actually $20,000 a month. So what you can see is we're talking about $240,000 a year if you add it up right, which I did not do in this example. But you're talking about literally hundreds of thousands of dollars a year. Dylan,
you're right.
Do I have fuzzy math? Am I right?
No, you're right.
Okay, good deal.
Yeah, I double checked it. Yeah. Okay.
And that's the reason why we want to make sure that we're capturing patients in the first place. So we at OptiCall have the ability to do it through the program that we've created. There are a lot of other programs that are out there that are available for practices to use that you can capture these patients that way, follow them through the process. Usually if we're doing a phone training or a training in front of people and we ask how many practices are actually tracking electronically, very few raise their hands. So if you're on the phone today and you do something electronically, kudos to you. That's one step ahead of a lot of practices out there. The real key is follow-up. And so as you can see here, there's quite a bit of revenue that's available for practices by doing that follow-up. So I'm going to open it up right now and talk. Just want to open it up for some questions that you might have about the concept of the logical progression that we went through, capturing a patient, anything that you have related to that, anything that you have related to follow-up plans too. And so let's open this up for some questions.
We do have one question from one of our existing customers that just wanted to know what are some of the main differences between the software we were using and the new OptiTRAK program?
Much better tracking on the level of every single phone call that comes through for a patient now. Even if they're already in the system, will show us repeat calls that come through. So it'll count not only the total number of phone calls, it'll break down how many of those are lead calls versus another type of phone call that might not be a lead call, and even if they're repeat lead calls. So there'll be a lot more information that comes through in the monthly reports, or actually the access that you'll have to the reporting.
And like the one that stands out to me is the weather feature, the time on the call. Those are both new features to the OptiTRAK system that I like. One of the things I thought might be worth mentioning when you were categorizing the status of the call, those that end up in phone inquiry, send information, and then phone inquiry still researching. When we do our mystery shops, we'll ask the practice what they feel like their current call to consult conversions are, and they'll usually throw out a number that's higher than what we would expect, and maybe 70% or higher. And then we'll ask them about the 5 calls that we just placed. And in a lot of the mystery shops we do, the callers are let off the phone without capturing any name or phone number, so they result in lost leads. And we'll ask them about those calls that were placed, if there's any record of those calls in the system, and typically they're not. So I think it's good to point out, it's good to have all that information so you know how many people are coming in. It's good to do an assessment so you can get an idea of how well your practice is tracking as well. That's something that we can offer to you with our free phone assessment. So when you close out of the call today, we do have a survey with an offer to get a one-on-one demo of the system for your practice. Perhaps if you're in a different specialty, we can show you how we handle the different specialties. We also have a mystery shop offer if you'd like to get a free phone assessment on your practice to get a barometer on how well your phone leads are converting to consultations. And there's also an offer if you just want to be contacted to learn more about OptiCall, how we might be able to help your practice.
One of the things,
feedback,
Dylan, that I think is important for people to look at too is how often do you follow up, when do you follow up? And that's all part of creating the plan, the actual follow-up plan that, with patients that are not booking. There are some keys to that. what I've seen in research is, and I've done this on my own too, and I found it to be effective, is the best days to follow up with anybody are a Wednesday or Thursday. Typically what ends up happening is Mondays and Fridays are just too busy. On Mondays, we're making up for the weekend. On Fridays, we've checked out for the weekend. And so Wednesdays and Thursdays tend to be the best times. Best times to reach somebody on those days is usually between 8 and 9 in the morning, or between 4 and 5 in the afternoon. Not saying that other times aren't going to be effective, but when you're trying to reach somebody, getting them first thing in the morning before their attention gets pulled away in so many other directions, or before they leave when they're kind of quieting down and winding their day down, on Wednesdays and Thursdays tends to have a bigger impact on doing some follow-up. One of the other keys is that you definitely need something to follow up with them for, because I'm sure, as people can attest that are on the phone today, maybe they've gone through the process of, they get somebody in the office for a consult, or somebody who's on the phone and they were really interested, and they do a follow-up phone call after an information packet is sent, or after that person attends the consult and they were all excited and went home, but still, had to think about it for one reason or another. You have to focus in on what it was that they were thinking about and use that as the hot button to try to get them to respond. If we're just simply trying to communicate with them and get them back on the phone, sometimes that doesn't work as effective, and we feel like, well, gosh, they were such a hot lead, and now they're not answering. So
at least have some new information to get their attention. We do have one more question here, Bill.
Sure.
Somebody's asking if they can use the software without having OptiCall take their phone calls.
We will be offering it for that. We're rolling it out for all of our current customers first, but we will be offering it out as a standalone scripting piece for practice to be able to use to track, and it is a system that's integratable with some pretty powerful follow-up programs as well. So that would be something that we're going to be looking at, I want to say maybe 6 months out or so, once we're solidly got it in with every practice that we're currently working with.
Yep. All right. Well, we were able to keep this to 30 minutes today. I appreciate everybody attending, and please stay tuned for some of our future webinars, and let us know if we can be a resource for anything. Bill, is there anything you'd like to add before we?
No, that's it. I appreciate everybody. I hope you all enjoy your summer, and we look forward to speaking to you again.
All right. Thanks a lot, everyone. Have a great day.
Thank you. Bye-bye.